Hello, everybody. Welcome back. Welcome to our afternoon session today of the Philippine Society of Microbiology and Infectious Diseases, better known as PSMID, for the 42nd all virtual. Yan po ang theme ng 2020. All virtual convention. My name is Topper Fabregas. I am one of your hosts today for Better Together, Meaningful Engagement of PLHIV in Healthcare. And joining me today is just one of my favorite human beings on the planet, Mr. Fee Palmas. Hey, Fee.
Hi, Topper. I'm so
Hi.
happy I get to do this with you. As in,
Absolutely.
ang tagal natin hindi nagkikita. As in, tama ka, ang theme talaga ng 2020 is virtual. As in, all virtual, all online. But we make it through. We make everything work, of course.
Yes.
So, yan, kumusta? Ako gusto ko munang kumustahin ka. Kumusta?
Oh. Gusto
Yeah,
ko naging chikahan na to bigla between the both of us.
oo, actually, wala na tayong pakialam sa program and all. Chikahan na lang. But well, seriously, I've been meaning to ask, and I think it's also important because me, I'm all out there, being an advocate and all, I'm all out there. But I'm quite sure most of us, those people who are watching right now, they're curious. And I've been meaning to ask you this, hindi pa kita natanong nito. Um, we know that you've been part of two landmark plays on HIV. 2015, we saw you in The Normal Heart, and just recently back uh, in Angels in America. But I'd like to know, like personally, everybody is also curious. When, when did you become active, or when did you start being involved in HIV?
I love that. Yeah, this actually started almost, I think, 10 years ago, or I think 9 or 10 years ago, when I was asked to do a workshop with the counselors of Love Yourself. This was for the counselors themselves. And it really opened my eyes to not just the people living with HIV, but also the people who are caring for these people. And I was also confronted with my own misconceptions about it, as I'm sure you know, diba? And to think na feeling ko na ang open ko na as a person, sabi ko, oh my God, there's still so much that I have to learn about this. And so I really just made it my personal mission that anytime something comes along that helps kind of spread that awareness little by little, I'll just say yes to it. Of course, I'm also lucky that I've been asked to do, like the Normal Heart and Angels in America. But to know, diba, that your work is so much bigger than just performance, that it's helping people understand this little by little, that just gives me so much joy. Yeah, and again, like what you said, no, I know that you are such a strong advocate for HIV awareness as well, and so I'm always just like, if I can help, if I can do at least, diba, 50% of what you're doing, my God, happy now.
Ang saya ko kasi ako, like, personally, hindi ko alam. I thought you, um, because I know that you had workshops during during the Normal Heart. So I really thought it started from there. And I'm just so happy. This is a discovery for me na long before that, you've been
Yes.
something na, that's why we get along just
Yes.
like,
And I love seeing, every time you post anything about HIV awareness, I love the stuff that I think you just did a fundraising recently for children and babies living with HIV. I mean, that advocacy, when I just see that just front and center in all your stuff, again, it just enriches me and just reminds me of, diba, why we should do what we do.
exactly, totoo. Kaya naisip ko lang naman gawin yan kasi, like, everyone naman is, minsan kasi parang, of course, we're so focused on testing and all of that, pero parang naisip ko, it's Christmas, so baka
Yeah.
pwedeng may gawin tayo with the kids, and Christmas is for kids. So,
Oh, no.
yun. So,
I
yun.
love that. That's so
So,
wonderful. And I also love what you said about, we're so focused, of course, on the testing. We want to get people tested. We want that education out there, but we also want to put a human face to what it's like to really live with HIV. Not just for people who are living with a capital L. They're living, right, with HIV. But
living,
you
yes,
absolutely.
focus on that.
Because I know, I personally know so many people, and again, living with a capital L. Like, I'm like, wow.
Ay, po sila.
Yes. But also the people who care for them, right? It's so nice to also just put a human face to the people who I know we've been saying front lines. This is like the word of the year for 2020. Pero sa totoo lang, I have been calling these people the frontliners for so long. They're really out there. It's all not it's selflessly putting themselves out there to care for the people, to again just spread knowledge, to I mean, just to erase the stigma little by little. I mean, yun talaga yung hats off. Yeah.
Grabe, ano, wala lang, I'm just overwhelmed, like, seeing you talk about these things because this is really, again, something that is
Oh,
very new to me. Ang saya-saya ko
yeah.
lang. Yeah. So,
Oh,
if
well, that's a reminder for me to be, I think, louder, because I thought that was already loud enough. Apparently not yet, and I will get louder, don't worry.
and we need those things to be loud enough, louder, louder, louder. Yes, yes.
Absolutely.
So this is going to be a really beautiful day. Well, thank you very much for that, Topper. And again, congratulations to the Philippine Society for Microbiology and Infectious Diseases. This is their 42nd, again, all virtual annual convention with the theme Expanding Horizons for Gold PMSID in the forefront against COVID-19.
Yes. This year is also the 50th anniversary of PSMID, and they have prepared a special program for all of us. One of the presenters during this all virtual convention is Sustained Health Initiatives of the Philippines, or better known as SHIP. Yeah, SHIP.
Yeah.
With the theme Better Together, Meaningful Engagement of PLHIV in Healthcare.
Yeah, so Ship has prepared an exciting and heartwarming program for you. Today is also an important day because December 1, it's World AIDS Day. And this year's theme is Global Solidarity, Shared Responsibility. Because now more than ever, I think we need to keep social solidarity alive. Yes. Since we can't meet and gather the way we used to, we have seen how we have adapted to the times and used the power of social media. So nagkaroon po tayo ng online poll kung saan hinikayat po natin ng ating mga kapatid na PLHIV na itanong ang mga bagay na hindi nila matanong during their consultation. And
Yes.
with our continuous effort of giving voice to the voiceless, or dun lang sa mga nahihiyang magtanong, we will give voice to those questions that you have long wanted to ask your healthcare providers or your doctors, yet you never dared to do so. So in our next segments, we will highlight the burning
Burning.
we've always wanted to ask our healthcare workers.
Yeah, I think that's one of the upsides of course, being an all virtual convention. I know a lot of us miss the face to face contact, right? Being in the same room.
Yes.
But the wonderful thing about this is that, yun nga, kung nahihiya ka to kind of ask these questions, now we have this wonderful platform that, diba, you can finally get those questions answered without having to come forward. So,
You can be
again,
anonymous. My God, everyone is so anonymous. Hello,
absolutely. Yeah.
Albert.
So we asked different PLHIV from the internet what they wanted to ask their doctors. And today, our very own HIV experts will answer your questions in our session, our open forum. Questions I want to ask my healthcare provider.
Hey.
So let's get this open forum started, shall we, Mr. Fee Palmas? I will take charge of our very first question. Our first question comes from Curious. Wow, Curious.
Curious. You
That
can
was
you can be anonymous.
Yeah, Curious. That was our name before Trust. As a person with an active sexual lifestyle with multiple partners, how often should I get my status checked? Great question. Here to answer that is Dr. Edwin Pasumbal of Bahay Lingad, the HIV treatment clinic of Jose B. Lingad Memorial Regional Hospital. Let's all welcome Dr. Edwin. Hi, Doc Ed.
Hello, good
Hi.
afternoon. Yeah, it's an honor to be invited
Oh.
to answer this question. Yeah, so with regards to that question, I think we have the slide. Yeah, I think I have a show. Hello. Okay.
Yes, Doc Ed.
Before I answer that question, no, yes, I just would like to highlight, no, just to give everyone an idea as to the status of our HIV testing in the Philippines. No, so this is on the integrated HIV behavioral and serologic survey being done by DOH. So this is actually the 2018 report, no, focusing on the key population or the most at-risk population. So based on this data, no, this consists of around 4,000 responders with a mean age of 22 years old. No, for the key population, particularly the MSM, the transgender men having sex with men, um, around 43% of these populations are actually aware of their HIV status, no, and around 32% have been tested, no, for the past 12 months, and only around 32%, no, are actually aware of their HIV status on for the past 12 months. Now, similarly, no, for the other groups like the female sex workers, no, so it's around 72% have been tested for HIV, 57% been in the past months, and around 4% actually are aware, no, in the past 12 months, no, and actually know their HIV status. Now, going back to the question, no, how often should high risk populations should be for HIV? So we actually have a local guideline on that, no, as to the frequency of HIV testing. So this is actually based on the 2017 policies and guidelines in the conduct of HIV testing services in the health facilities. No? So based on this recommendation for the key population, so that includes the MSM, people in prisons and closed settings, the IV drug users, the workers, no, the transgender men and women, the recommendation is for them to undergo HIV testing every 3 months. Now, for the pregnant women who belong to the key population or a pregnant woman who is a partner of a person living with HIV, the recommendation is to have an HIV test done on the first trimester of pregnancy, the second trimester, the third trimester of pregnancy once, not during the time of breastfeeding. Now, lastly, what about for the casual or intimate partners of key populations or persons living with HIV? The recommendation is for them to undergo HIV testing at least every year or annually. So that is our local recommendation. Now, lastly, I would like to emphasize so that HIV testing is really the key. So we referred that to the fact that there should be improved coverage as well as improved frequency of testing, no, in able to be able to earlier detect this key populations who might be infected with HIV and provide prompt linkage to care. No, it is also very important that they access treatment and care in order to be able to preserve their immune function, achieve viral suppression, and lastly, this is also an important tool to reduce the transmission, no, or the risk for transmission of HIV. So I think that's about it.
So, Doc, you really recommend
Yes.
at least an annual check,
Yes.
for anyone who engages in any intimate, di ba, in any sex, no? So, regardless of whether nasa
Yes.
nila, paano naman kung palagi naman akong safe, palagi naman ako nagko-condom, right? It's just a matter of like an annual sort of thing to always kind of check in and to just check in with the body.
Yeah. Wala.
Doc Ed?
Yeah, but I think it's also very important to note and to remember na yun nga yung 3 to 6 months 3 to 6 months na pwede ka magpa-check because as we know because I'm
Hello.
quite sure. Hello, hi,
Ayun, Doc.
hi Doc.
Yeah.
Yan.
Yeah.
Is that?
Medyo choppy. Yeah. We're yung signal. Okay.
Yun nga pa as I was saying po, I mean we also need to always remember the 3 to 6 months period wherein we can have ourselves checked, especially if we have an active sex sex life. Ayan, because we
Yes,
know
that
that
is,
between 15 to
it's
24
very, very important.
years old, yes, 31% ang total na new HIV infections coming from that age group. At alam naman natin kung
Yes.
sino ang medyo active at exploring in terms of their sexuality, right? So 3 to 6 months, and then all of those things that Doc recommended. Yan. Thank you very much, Doc.
Thank you very
Thank you so
much.
much, Doc Ed.
Ayan, para sa ating susunod na katanungan.
Mm.
Okay. Kapag HIV positive, mas prone ba sa mga sakit na sexually transmitted? Mas madali bang mahawa? Okay, ang ating expert na sasagot sa katanungang ito ay si Dr. Pamela Ferrer, Southern Philippines Medical Center. Hi, Doc Pam.
Hello, good afternoon, Topper and Fee.
Hello.
Ayong hapon sa inyong tanan. Okay, so sa answer sa kanyang tanong, maari pa ring magkaroon ng tinatawag na sexually transmitted infection or sexually transmitted disease. Ito yung STI or STD, ang isang HIV positive patient. Lalong-lalo na sa mga ganitong sitwasyon, no? Pakikipag-sex na hindi gumagamit ng condom kasama ng mga multiple sex partners including casual sex and anonymous sex, and also through vaginal and anal sex. Ang isang HIV positive patient ay pwedeng makahawa ng kanyang sakit na HIV sa partner na meron ding STI or STD. Maaring pumasok ang HIV virus sa mga sugat ng STI kung hindi gumagamit ng condom during sex. Ano ba tong STI or STD na tinatawag? Ito yung mga sakit na maaring makuha sa pakikipag-sex habang walang kondom. Katulad ng syphilis, gonorrhea, chlamydia, genital warts, hepatitis B, and trichomonas. Maaring ihawa ng isang buntis na mayroong STI or STD ang sakit sa kanyang pinagbubuntis. So ano yung mga rekomendasyon natin? Kung ang isang pasyente ay HIV or ikaw ay HIV positive, ang rekomendasyon ay magpa-test ka for STD or STI, gumamit ng condom or mag-abstain sa sex, magpagamot sa doktor if na-diagnose na meron kang STD or STI, at tuloy-tuloy na uminom ng iyong ARV meds or tinatawag nating antiretroviral medications. If meron ka namang STD or STI, magpakonsulta naman sa doktor para sa tamang lunas at gumamit din ng condom during sex or mag-abstain sa sex. Importante na magpa-test din for HIV ang isang patient na unang na-diagnose with STD or STI. So ang HIV positive patient ay maari pa ring mahawa at makahawa ng STD or STI. So yun nga, sabi natin, walang gamit na condom during sex, mas mataas ang risk. Katulad kung kasama mo ay marami kayong partners na nakikipag-sex. At lalong-lalo na kung hindi umiinom ng antiretroviral medicine ang isang patient na HIV positive. Back to you, Topper and Fee.
Yes. Thank you
Thanks,
very
Dr. Pam.
Yes, Doc Pam. Thank you very much. And yes, so we should always remember na, well, if you're HIV positive, we know that you're immunocompromised. So, yes, hindi lang sa sexually transmitted infections, but all other diseases. So we have to take care of ourselves. But before we know that, we have to have ourselves check para alam natin ang ating status. Di ba po, Doc?
Correct.
All right. Thank you very much, Doc Pam.
Thank you, Doc Pam.
All
right, for question number 3, magkakaroon pa po ba ako ng mga opportunistic infection kahit naka-antiretroviral ako? Gagaling pa ba ako? And here to answer this question is Dr. Rosana Ditanco of Research Institute for Tropical Medicine or RITM. Hi, Dr. Rosana.
Hello, Topper and Fee.
Hello.
Hi,
Siguro,
Doc.
sa una, magbigay muna ako ng simple definition, ano ba yung OI, no? So, ito
Yes,
yung
please.
infection or mga sakit na karaniwan, ang sanhi nito ay mikrobyo na talagang nasa loob na ng katawan ng isang tao. Pero dahil malakas ang kanyang immune system, na kokontrol niya itong mga mikrobyong ito or nalalabanan niya, tahimik ito at hindi nagkukos ng kahit anong sakit. Pero kapag humina na ang immune system, ano siya, parang opportunista ito, no, take advantage of the weak immune system at magkakaroon na ng sakit, no, yung tao depende kung ano tong mikrobyo na ito. At ang some of this may be very serious na mag-require na ma-hospital yung isang PLHIV or even can cause death. Ngayon, ang sagot natin diyan sa tanong ay hindi na. Yun ang pinakasimpleng tanong. Kung siya ay naggagamot na for at least 3 months at ang kanyang viral load ay undetectable, hindi na siya maaaring magka-OI, lalo na yung mga serious OI. Kasi, at yung mga OI na yan, pwede yang magamot. No? May mga specific treatment para dyan sa mga OI na yan. At kung ang kanyang viral load ay undetectable na, mas madali yan gamutin at hindi na yan mauulit. Pero, meron tayong mga tinatawag na so-called minor OIs, no? Ito yung mga infection na nakikita rin kahit sa mga taong walang HIV, pero merong kahinaan ang kanilang immune system. Halimbawa rito, yung tuberculosis o herpes zoster, no? So, depende sa lifestyle ng isang PLHIV, depende kung gaano kababa na ang kanyang CD4 count or yung kanyang exposure kahit undetectable, pwede pa rin siyang litawan nitong tinatawag natin mga minor OI na ito. Pero ito, gusto kong i-emphasize, bihirang-bihirang nangyayari ito kung ang taong may HIV ay undetectable na ang viral load. This is very uncommon, pero maaari pa rin. Ngayon, meron pang isang phenomenon, no? Ang tawag natin dito ay IRIS or Immune Reconstitution Inflammatory Syndrome. Ito ay dahil din sa mga infection na hindi nakita bago mag-start ng ARV ang isang PLHIV. Karaniwan, ito ay nangyayari sa isang PLHIV na napakababa na ng CD4 bago siya mag-start ng kanyang ARV. Kaya maaaring yung infection na meron siya ay tahimik, pero once na uminom siya ng ARV at lumakas ang kanyang immune system, itong silent infection na ito ay maging symptomatic na. So iisipin ng isang PLHIV, nagkaroon siya ng bagong infection, pero hindi. Dati na to, hindi lang na-detect. So kapag ganito, pag iris siya, ang ginagawa lamang ay pinagpapatuloy yung paggamot because parang sinasabihin natin it's a good problem kasi it's a sign of immune recovery, no? So kaya itinutuloy lang ang ARV at ginagamot kung ano man yung iris na lumitaw. Halimbawa, ang pinaka-common dyan yung tuberculosis. So, na iris, kaya ang halimbawa makikita mo na lumalaki yung kulani sa lieg. Dati wala naman, no? But it's a sign of immune recovery at nilalabanan na ng immune system yung tuberculosis na nasa kulani ng isang tao na dati hindi pa niya kayang labanan. So whether this is a serious OI or minor OI or iris, ang importante magpapa-check up ka agad upang malaman kung ito ba talaga ay dahil humihina na uli ang iyong immune system dahil ang iyong gamot ay nag-fail. So importante 'yon. Hindi tayo dapat mag-iisip, ay hindi iris lang to, ay hindi minor OI lang to. Hindi, dapat magpa-check up ka agad upang malaman kung ang iyong ARV ay still nag-work. Pero again, kapag ka talagang umiinom ka na ng ARV mo at undetectable ka na, napaka-unusual na magka-OI ka pa.
Thank you, Dr. Asana, for also clarifying that the OI is, diba, hindi lang with people with HIV, it's everybody, diba? And the most important thing is that, yun nga, once you start the medication, once you start your ARVs, bababa yung viral load mo, you come to undetectable status, and then your immune system starts to repair itself. Also good to know, I like what you said also about that, what do you call this? Yun nga, na
Iris?
sometimes, the iris, that any other infection that might that might have been dormant, diba? Biglang lalabas lang, but that's also a sign that your ARVs are working and your body is fighting it, right? And repairing itself. But the bottom line, take your ARVs, right, Dr. Rosana?
Take your ARVs,
That's it.
bitches.
Bottom line.
Bottom, bottom, bottom.
Bottom.
Okay, bago pa tayo mapunta kung saang bottom.
Oh, nako. Oh
Next
gosh.
question. Okay, our next question comes from a concerned letter sender. I started taking LTE in 2018. I am undetectable now with a CD4 T cell count of 500. Is it normal to still experience its side effects like vivid dreams, hot flushes, dizziness, and skin itch, little bumps on my knees and ankles? Ooh. Okay, so here to answer our question is Dr. Christine Ramos Peñalosa of Philippine General Hospital. Hi, Dr. Christine.
Hello, Topper and P. So let me answer the question. So despite taking the medications for 2 years already, yes, some patients will still experience side effects from the antiretroviral medications. For the LTE, this is mostly due to the efavirenz, the vivid dreams, and the dizziness. Okay, and initially, these side effects should have subsided or diminished after 2 to 4 weeks. And then some of the advices that we give our patient is to take this at bedtime and also to take it without food to lessen or reduce the symptoms. Antiretrovirals in general have adverse effects. They can be early or long-term adverse effects, and there are several factors identified in the literature that predispose patients to these adverse effects. One is concomitant use of other medications with possible toxicities. Second is the presence of comorbid conditions, especially liver disease, say from alcohol or from hepatitis. This can increase hepatotoxicity of efavirenz. For kidney disease, there will be increased nephrotoxicity, say from tenofovir. Another factor is the exacerbation of pre-existing conditions. If our patients have psychiatric disorders and they are on efavirenz or rilpivirine, this can be exacerbated. Another factor is drug-drug interactions. Commonly, our patients are on TB medications such as isoniazid that can have interactions with efavirenz. And lastly, genetic factors that predispose patients to, say, abacavir hypersensitivity reaction, and also efavirenz neuropsychiatric disorders. But more importantly, let me tell you about serious life-threatening events that require immediate discontinuation of all antiretroviral drugs and reinitiation of an alternative regimen without overlapping toxicity. So one is severe cutaneous reaction, such as Stevens-Johnson syndrome and or toxic epidermal necrosis from drugs such as nevirapine and efavirenz. I've already mentioned abacavir hypersensitivity reaction, which should be discontinued and never re-challenged yung abacavir. Another serious event is fulminant hepatitis that can lead to death or hepatic failure, which can be seen for efavirenz and nevirapine-based therapies. Another serious event is that of psychosis and suicidality. In the studies, it was shown that efavirenz-containing regimen are associated with a twofold increase in the risk of suicide. Okay, for long-term, long-lasting toxicities, I will mention lipodystrophy and peripheral neuropathy. So for lipodystrophy, it means there's a change in body fat. So it can be both lipoatrophy or lipohypertrophy. So when we say peripheral lipoatrophy, this is loss of subcutaneous fat of the limbs, the buttocks, and the face. And this is associated with zidovudine use. So even when zidovudine is switched or changed to another ARV, the fat recovery remains slow or may take years and incomplete. Lipohypertrophy, or the accumulation of visceral, truncal, dorsocervical, and breast fat, has been observed for agents such as lopinavir, ritonavir. So what do we usually advise our patient, or what has our patients done and showed us to improve this lipodystrophy condition? So our patients have been doing more exercise or going to the gym to increase muscle mass in areas with lipoatrophy and decrease fat in areas with lipohypertrophy. Some literature will mention liposuction or surgical removal of fat and injectable facial fillers for this lipodystrophy. How about peripheral neuropathy? This has been seen from older agents such as tavudine. Also, some studies showed peripheral neuropathy from zidovudine and even lamivudine. Okay. So for chronic life-threatening adverse events such as dyslipidemia, the advice is to switch to another agent or to manage with pharmacological drugs such as statins or non-pharmacologics such as exercise and low-fat diet. What is important is that the management strategies must be individualized for each of our patients. Switching the regimen to an effective ARV agent must always take into account that the potential benefit will outweigh the risks. And ultimately, our goal is to maintain viral suppression for our patients. That's it, Topher and Pai.
Thank you very much po, Doc Christine. I think it's very important na malaman and take into account na if ever may these are normal, will always have, laging meron talagang mga side effects ang mga gamot. What's important is that we communicate this to our healthcare providers. Huwag po tayong mahihiya para malaman natin kung kailangan bang i-change yung ating mga gamot o these are just natural or if there's anything that we can do to address it. Again, thank you very much, Doc Christine, for this. Have a great day.
Thank you, then.
All right, our next question, the golden question, as I'd like to call it, no, is from
Yes.
inquiring netizen, and this question is, what does undetectable mean? And to answer that question, I'd like to call in Dr. Eileen Gianan Gascon of RITM. Hi, Doc Eileen.
Hi,
Thank you
good
for answering my
afternoon.
favorite question.
Golden question pala tong napunta sa akin, no? To answer it, actually, undetectable viral load means na yung level of the virus in the blood is so low, sobrang baba niya, that it cannot be detected by standard tests, no? So sometimes patients would come to us saying na, Doc, less than 34 copies per ml, yung iba naman less than 40, no? So it varies from country to country, iba-iba siya, but it depends on the tests that are available. But as long as the viral load is less than 200 copies per ml, then you are considered undetectable already or virally suppressed, as what we call it, no? So it means that your ARVs, the ART, is effectively controlling the virus. So ano yung implication nito? So ang ibig sabihin nito, it will protect your immune system and help a person stay in good health. So, kanina nasabi na nga ni Dr. Annie De Tangco, di ba? If a person is undetectable, then the chances of that person having an OI or an opportunistic infection is a very, very low. Halos wala na nga eh, di ba? No na nga yung sagot niya, except in certain cases na sinabi na niya kanina. So, being undetectable also means that you cannot transmit the virus sexually. So, yung sexual transmission part, we've been hearing a lot about U is equal to U, di ba? Yung undetectable is equal to untransmissible. So, yun ang ibig sabihin nun, no? Yung sexual transmission part. So, majority of the studies or yung mga pag-aaral na sa nakakarami about U is equal to U ay tungkol doon sa sexual transmission part. Wherein, pag ang isang tao ay undetectable, then
there is effectively no risk of transmitting that virus sexually. But we must also remember na there are other routes of transmitting the virus. Hindi lang naman yung sa sexual transmission. We must always remember that a mother-to-child transmission, no? Pwede rin yun, excuse me, through breastfeeding in certain cases, sharing of needles, no? But a majority of the researches na ginawa na is about sexual transmission. Now, i-mention ko na din yung tungkol sa pregnancy, labor, and delivery. So, let's say a mother has HIV and effectively taking the medications, adherent naman siya, and undetectable siya, then the risk is 1% or less. No? So, masyadong mababa yon. Pag breastfeeding, may mga studies din about breastfeeding. No? So, they found out that the undetectable mothers, yung mga undetectable na yung kanilang mga viral load, were not able to pass it on to their infants or to their babies. Yung isa, yung sharing of needles or syringes, yung drug injection equipments, actually, the risk is unknown, but sinabi nila, or according to CDC, there is likely reduced risk. No? So that's the answer to the question of undetectable. Back to you.
Amazing, no? So again, the bottom line is just take your ARVs, take your meds, right? The minute you get to
Correct.
undetectable, that's when you start, again, like we said earlier, living with a capital L, right? With HIV.
Right. Oo. So that people with undetectable viral load, like I always say, they can be very productive citizens of the country. Um, balik to ano, to parang walang sakit, no? As long as they manage to keep themselves undetectable, then I don't see any problem.
Thank you so much, Dr. Eileen. That was amazing. Thank you for answering
Thank
my
you.
favorite question.
Thank you, Topper.
Thank you. Thank you very much, Doc Eileen. Okay, for our next question, ayan, from Worry. I am a PLHIV for 5 years with a baseline CD4 count of 23. My latest is 200. I am currently undetectable. I'm worried about the count. Does it mean that I am having problems like persistent immune activation? Okay. So, here to answer your question is Dr. Maria Tercela Blair of Makati Medical Center. Okay, that's a handful of a question. Hi,
Maganda
Doc.
hapon, Topper and P.
Hello.
Ng hapon. So, siguro para masagot yung tanong na yan, no, we have to explain first kung ano yung CD4, bakit siya naging 23, at bakit ngayon 253 lang siya, no? So, ang CD4, parte yun ng white blood cell natin na kung saan tinitira ng virus, ng HIV virus. So, viruses usually do not need a cell, yung mekanismo ng human cell para mabuhay, no, para magdumami. So, ang ginagawa ng HIV, papasok siya dun sa CD4, dadami siya doon, papatayin niya yung CD4, tapos pupunta na naman siya sa ibang CD4 cells. So, ang nangyayari, eventually, bumababa yung...
So, multitasking po si Doc. Yes! I love this.
Sorry. Kasi nasa conference hall ako eh. So, eventually bababa yung CD4. Ngayon, ang normal na CD4 ay 500 to 1,500, no? Tapos, teka lang sandali.
It's okay, Doc. I love this. Ito po ang talagang true to life what our doctors and nurses have to deal with every day. So, saludo.
Balik na.
Okay, and you're here again.
Ang normal na CD4 ay 500 to 1,500. So kung merong HIV at immunodeficient ka na, di ba? Hindi naman lahat ng HIV ay immunodeficient. So pag sinabi ka ng may AIDS, ay less than 200 na yung CD4 mo. Siyempre, kung nagagamot ka ng ART, ito dahil wala na, kumukonti na yung HIV na magpapatay ng CD4, no? So, eventually tumataas siya. Pero bakit hindi dito sa kasong to, 5 taon na siya, hindi pa rin siya tumataas? So, gusto na yung sinasabi niyang immune activation is a concept in HIV na kasi nagkakaroon ng aberrant immune reaction yung mga taong may HIV. Ang tawag, nagkakandaloko-loko, no, yung immune reaction natin. So, deficient ka na nga, pero meron pa ring immune activation. So, yung immune activation is the release of yung mga inflammatory proteins sa katawan, na continuous release ng inflammatory proteins dun sa mga taong may HIV. So marami itong rason. Itong cartoons na pinapakita ko ay shows this parang konti explanation ng immune activation and persistent inflammation. So marami itong rason, pwedeng mga co-infections like hepatitis, CMV, or yung EBV na virus, mga co-infections ng viruses na to. So ang itong mga iba-ibang kulay ng mga bilog-bilog na yan, these are what we call cytokines. Ito yung mga agents or mga proteins na nag-continue ng inflammation sa katawan natin. Kaya yung mga may HIV, maski naka-ART na sila, ay meron pa rin silang continuous na immune activation. This actually is the reason for the early, yung mga sa mga HIV, mas mabilis silang mag-develop ng chronic diseases like heart disease, diabetes, kasi nagkakaroon ng organ dysfunction, no? So, and one of the reasons why mas matagal ito or mas malala, kasi kung mas matagal kang nagagamot ng ARV. So, very important yung early testing and early treatment, kasi kung mas maaga kang magamot, no, mas mas mabilis mas malilesen itong continuous immune activation and persistent inflammation. So mas mabilis itong nalilesen, no? But the longer you have been infected or the later you've been treated, mas din siya, mas matagal din siya mag-resolve or minsan hindi nagre-resolve. Kaya isang very important is for people to test para mag-treat ka agad. Ma-treat ka agad at ma-lessen itong immune activation. Sana nakasagot ko yung tanong ni concerned citizen.
Hi, well, I think hindi na po siya masyadong worried. Ayan, si ating worried na nagtanong. And I think it all boils down to, again, paulit-ulit tayo, continue taking your meds. Take
At
your
saka
ARV.
early testing. Very important. Early testing.
Yes.
So, hindi pa mababa ang CD4 mo na nag-inom ka ng gamot, mas better, di ba?
Yes. So, at least po, ang masasabi natin sa kanya, huwag ka nang mag-worry about the persistent immune activation. What's important right now is that you are undetectable. Sabi kanina, hindi ka na makakakuha ng OI once you are undetectable, and have yourself regularly checked. Ayan. Thank you very much, Dr. Claire.
Thank you
Ayan,
so
pwede
much, Doktora. Thank
Pwede po
you.
kayong bumalik sa inyong trabaho.
Yes. So, double booking po si Doktora ngayon. Most
Yes.
requested.
Thank you, Doc.
All right. So, for our next question, no? Papalitan din ba eventually ang first-line antiretrovirals LTE or lamivudine, tenofovir, efavirenz to TLD, tenofovir, lamivudine, dolutegravir. Apologies if I got those things wrong. Hindi ako nakatapos ng college. Here to answer our next question is Dr. Mark Christopher Pasayan of RIT.
Okay. Hi, Topher and
Hello.
Fee. Shout out to Dr. Katerina. Di ba nabubulol ka dun sa mga medicines?
Medyo. I tried my best po.
Let me just give you a quick backgrounder kung ano yung LTE before we talk about TLD. No? So LTE for HIV medicine, it's usually composed ng tatlong gamot. Tatlong gamot na nakalagay sa isang tableta. And based on the recommendation of WHO in 2016, ang first line na gamot natin for HIV ay yung tenofovir, lamivudine, and efavirenz. Shortly, it's usually called tenolami-efab. In lay people, LTE or yung 3-in-1. Now, there is now the WHO recommendation of 2018 na papalitan yung efavirenz ng dolutegravir. So it will be composed ngayon ng tenofovir, lamivudine, and dolutegravir. This is based doon sa mga latest evidences at data na mas effective, mas safe, mas less din yung interaction ng dolutegravir with other drugs compared doon sa dating gamot na efavirenz. So dahil dyan, meron na ngayong move ang Department of Health na palitan yung ating first line base sa WHO recommendation mula LTE, gagawin na siyang TLD. At ito ay isang proseso ng pagpapalit base sa latest na plano ng DOH. Ang mga pasyente na sisimulan dito sa gantong combination ay yung mga number 1, bagong diagnose ng HIV at sisimulan pa lang at first time na magagamot ng ARV. Pangalawa ay yung mga nakakaranas ng side effects doon sa current na LTE. Ito yung mga nagagamot na pero hindi matolerate yung current nilang gamutan na efavirenz. Sila din yung pwedeng palitan ng gamot at gawing LTD. At pangatlo, ito yung mga hindi na effective yung current regimen na LTE because probably of resistance or hindi na effective yung LTE para masuppress o maging undetectable yung virus. Sila din yung good candidates para palitan yung TLD. Now, should all these patients be changed from LTE to TLD? Well, there are a lot of factors that we should consider and we will follow yung current program ng DOH kung sino ba talaga yung papalitan ng gamot. Nakasalalay din kasi dyan yung supply ng bagong gamot. And pangatlo, dapat din natin maintindihan na ang TLD or yung dolutegravir containing na ARV ay parehong first line at second line. Ito ay dapat din i-reserve natin para doon sa mga pasyente na mag-fail yung kanilang first line. So kung wala namang indikasyon para mag-TLD, yung mga currently na mga pasyente na naka-LTE, we'll stick to the LTE. But dun sa mga bagong diagnosed with HIV at magsisimula pa lang ng gamutan, base sa programa na niluluto ng DOH, sila ay makakatanggap na ng TLD. Over to you, Tower and Fee.
Thank you so much. In other words, again, the medication is just getting easier and easier. Easier than actually pronouncing the medication itself.
Easier, safer, and more effective.
Thank you. Thank you so much, Doc Mark.
All right. Salamat, Doc Mark. So let's go on to our next question. Where can we find a one-stop shop for all the vaccines recommended for HIV-positive individuals? Oh, this is something interesting. Okay, so here to answer our question is Dr. Michelle Bonaby Bala of Vicente Soto Memorial Medical Center. Hi, Doc Michelle.
Yes.
Mayong hapon from Cebu.
Oh, wow.
Yay.
Mabuti at naitanong niyo po no, yung regarding sa vaccines kasi importante ang magpabakuna lalo na sa panahon ngayon and more so sa mga pasyente natin na may chronic health conditions katulad ng HIV kasi pag mahina kasi yung immune system mo, mahihirapan ito to fight off vaccine-preventable diseases katulad ng pneumococcal disease at yung flu. At pwede na mas malala ang komplikasyon na makukuha mo pag magkasakit ka nito, kaya dapat isama ang pagpapabakuna sa overall na HIV healthcare plan mo. Pwede nyo pong ma-avail ang mga recommended vaccines mismo sa clinic ng inyong doktor or sa treatment hub. Dapat lang po na magpa-schedule kayo kung kailan pwedeng magpaturok ng bakuna.
Okay. Meron po akong... Hello?
Yes. Yes, P.
Yes. Just continue. Sorry, Doc.
So, yung mga recommended vaccines na ay magdedepende sa CD4 ng pasyente. I think na-discuss naman ni Dr. Claire earlier, no, yung ano yung CD4. So, marker po siya ng immune response. And yung vaccines ay mas gumagana if ang CD4 is more than 200. But regardless of the CD4 count, kailangan nyo po mabigyan ng hepatitis B, pneumococcal vaccine at siya yung flu vaccine, yung mga nasa green boxes po. Ang hepatitis B vaccine ay binibigay at 0, 1, and 6 months at 2 vials ang tinuturok. Ang inactivated influenza vaccine naman ay binibigay annually, usually between February to June po siya available, and this is good for 1 year lang po. While yung pneumococcal vaccine ay 2 klase po yan siya. Ang 13-valent na conjugate vaccine binibigay first, then followed by the 23-valent polysaccharide vaccine after 8 weeks, then another dose naman ng 23-valent after 5 years, then that's it na po. So, may mga karagdagang bakuna pa na pwedeng ibigay sa mga patients na less than 200 ang CD4 if indicated po, katulad ng Haemophilus influenza type B, so especially sa may problema sa spleen or lapay, yung hepatitis A vaccine for patients with chronic liver disease or may clotting disorders, or if may risk sa trabaho po like mga healthcare workers or yung mga food handlers. Yung human papilloma virus vaccine naman ay pwedeng ibigay before mga if na may potential na exposure to sexual activity, while yung meningococcal na vaccine is if may risk po na exposure to meningococcal infections. If hindi naman po sure na merong previous na immunization before, yung patients na less than 200 po yung CD4, pwede silang mabakunahan against tetanus and yung diphtheria. If mataas na yung CD4, pwede na po na mabigyan ng, if more than 200, pwede na po sila makareceive ng measles, mumps, rubella, and yung varicella na vaccine. If indicated at if may risk po na exposure, like if they are healthcare workers. Yun po ang mga regarding sa vaccines.
Okay, thank you very much, Doc Michelle. Pero may follow-up questions po ako. Okay, so diniscuss nyo po yung mga recommended na mga vaccines for HIV, for people living with HIV. Meron po bang kayong mga vaccines na kailangan at ano ang mga vaccines na bawal naman for HIV positive individuals?
Okay, so yung must talaga na vaccines, no, as I mentioned, is yung hepatitis B, yung flu vaccine, at saka yung pneumococcal. Ang bawal naman po, ang mga bakuna na hindi pwede ibigay sa mga patients na may HIV is yung oral polio vaccine, yung BCG, yung oral na typhoid vaccine, yung intranasal na influenza, at yung herpes zoster vaccine. Because these are live na vaccines, so parang live, medyo, buhay pa yung virus, pero parang weakened lang po na virus, and then they can potentially cause infections in our HIV patients, kaya bawal po sila, yung mga live.
Okay. Ayan, maraming salamat, Doc Michelle, because I know marami akong kakilala din na they really want to avail all of these vaccines, pero minsan trigger happy tayo, gusto nating sige i-vaccinate lahat ng pwede para we can protect ourselves, pero it's very important, and thank you very much for informing us kung ano yung mga pinakakailangan at mga bawal para sa ating mga kapatid living with HIV. Again, thank you very much, Doc Michelle.
No problem po. Thank you.
Alright, for our next question, no, magkakaanak pa po ako kahit pause ako? And here to answer that, we have Dr. Helen Madamba, an obstetrician, gynecologist, IDS specialist from Vicente Soto Memorial Medical Center. Hi, Doc Helen.
Hi, good afternoon,
Hello.
Topher and Five.
Hello po.
Waving hi from Cebu. So it's a basic human right to be able to build your own family. So whether you have HIV or not. So pwede pong magkaanak ang isang taong may HIV or isang taong positive for HIV. There are ways in which we can prevent mother-to-child transmission. The first is family planning. Even before you get pregnant, you want to be able to decide when, with whom, and how often you get pregnant. So family planning, marami iba't ibang available na options for family planning. The second is during pregnancy, we want pregnant patients who are HIV positive to start on ARV, on antiretroviral drugs, because undetectable equals untransmissible. If you're already on ARV, we want you to continue taking your ARVs. If you have been diagnosed or first diagnosis for HIV, then we will start you on antiretroviral drugs at 14 weeks age of gestation. The next part is during delivery. So the standard of care is through cesarean delivery. However, we do allow vaginal delivery if the pregnant patient has adherence to antiretroviral drug and is undetectable on the latest viral load. And then during postpartum, the family, the couple, and the doctor has to have a serious discussion on infant feeding. They have to decide whether they will exclusively breastfeed or exclusively provide alternative feeding options for the baby. So we do not recommend mixed feeding because there might be increased risk of transmission to the baby. And then also, a bottom line of this is if there are discordant couples, no, meaning ang isang partner is positive, the other partner is negative, you also have available PrEP or pre-exposure prophylaxis so that the HIV negative partner will not get HIV from the HIV positive partner. So babalikan natin also yung undetectable equals untransmissible. So pwedeng mag-build ng family basta pagplanuhan natin. So meron forever sa HIV, no? That's the antiretroviral medications. It has to be forever, for life yan. Mm-hmm. And one of the HIV positive individuals that have been famous, no, he said that having a negative family is one of the most positive things in his life because siya HIV positive since birth, ang wife niya negative, ang 3 beautiful children nila negative.
Thank you so much for answering that so beautifully and for really reinforcing that it is a basic human right to start a family. Thank you so much. At buti pa yung HIV meds, may forever po sila.
Oo nga.
Thank you so much, Doc Helen. That was amazing. Thank you so much.
Yes, thank you then.
Thank you very much po. Oo nga. Buti pa doon may forever.
Hi.
All right. So, for this next question. If HIV has been around for 2 decades, why are there still deaths related to HIV? Okay. So here to answer our this question is Dr. Nerissa Sescon from Hospital ng Santa Ana. Hello po, Doc Nerissa. Grabe. Worldwide, it's 3 decades. Dito sa Pilipinas, 2 decades ng HIV. Bakit nga daw po may mga namamatay pa?
Hi, Fee. Hi, Topher. Can you hear me now? Is it
yes,
clear?
We can hear you loud.
Okay. Yeah, thank you. So we look at first the numbers of our deaths in the Philippines. So despite the availability and accessibility of antiretroviral drugs, we could still see a number of deaths. As of September 2020, we have 4,196 deaths among our people living with HIV, 95% of which are males, and 52% of which are 15 to 24 years of age. However, we have a limited data on the quality causes of death. So we try to check on the case surveys and studies done abroad. So abroad, they say that the most common cause of the death or the AIDS-related mortality is late detection. So people come in late on their disease. They're already on the age stage of disease. So they're having more complication and initiation of the antiretroviral drugs, or they would have increased risk of the side effects of the antiretroviral drugs. So apart from the medical factor, we also need, and it is also crucial to address the other factors, the psychological factor, the socioeconomic factors. For socioeconomic factors, it is the proper nutrition, a safe environment, a clean environment for our patients, and also their source of livelihood. So some patients would lose their jobs because of frequent sick leaves and due to their illness. So nawawalan sila ng source of living. So hindi kaya ng medical part lang o ng antiretroviral na gamot lang. So meron pa rin silang ibang pangangailangan. So psychosocial, mental health. We all know that people who are sick are at risk of mood disorders, anxiety disorders, and depression. So studies abroad would show that the most common cause of non-AIDS death is drug overdose and suicide. So it's very important to address these factors as well. So with these findings, we need to highlight again the prompt diagnosis, we have to start the antiretroviral drugs promptly, and remember to sustain them. So hindi lang starting. Kailangan, sabi nga niyo kanina, forever. So we need to take these medications with good compliance, so the adherence should be there in order for us to have a viral suppression. And lastly, we have to have care engagement also with our patient and optimum management of the comorbidities, including that of the socioeconomic and the psychological factors in order to reduce the mortality of HIV and AIDS. So these are the hotline or the numbers that one can call, including that of our care providers. Thank you. Back to you, Fee and Topper.
Thank you so much. Yes, pa-screenshot na yan our
Yes,
front helplines.
Thank you very much, Dr. Risa. Ayan. So,
Thank you.
Thank you. Ayan.
All right, so
Yes.
now we're down to our final question. My gosh, ang dami ko natutunan. Our final question is from one of our healthcare workers. I am a nurse by profession. I would like to become an HIV counselor. Can you tell me how? Here to read the answer from Dr. Gerard Belimac of National HIV/AIDS and STI Prevention and Control Program is our very own Dr. Kate Leyritana. Hi, Doc Kate.
Hello, I'm privileged to answer this question on behalf of Dr. Belimac. So, Republic Act 11166, which is known as the HIV law, says that under sections 29 and 31, pre-test and post-test counseling shall be done by social workers and health service providers or an HIV and AIDS counselor. So, ikaw, bilang isang nurse, maaari ka mag-provide nito without needing to undergo specific training dahil healthcare worker ka. This falls under Provider-Initiated Counseling and Testing or PICT. So kung sa paggawa mo ng duties mo bilang nurse or bilang doktor ay gusto mo mag-encourage na isang pasyente na mag-HIV test, please do so. You should be able to do so as you practice your profession. Ngayon, sa mga hindi naman healthcare worker at gustong maging counselor, kailangan mag-training because this will fall under voluntary counseling and testing. When the clients themselves voluntarily request for the HIV test and ask for your guidance. In situations like this, kailangan na train ka by an institution or organization accredited by the DOH to provide counseling service on HIV with emphasis on behavior modification. Meron din tayong isang procedure na maaari mangyari before HIV testing, and this is called HIV screening, kung saan rapid test ang ginagamit. At maaaring gawin ito ng isang community-based screening or CBS motivator or healthcare workers.
Thank you so much, Dr. Kate.
May follow-up question ka ba?
So far, we're all okay, Dr. Kate. In fact, I learned so much just from listening to everyone, all our 11 doctors today.
Well, ako meron akong follow-up.
Ay, meron pala si Fee. Ayan, dito pala si Fee.
Yes. Okay, so since ang theme ng 2020 ay all virtual, everything online, meron po bang available training online if I want to be an HIV counselor?
So currently, the DOH Academy e-learning team, in coordination with the NAS-PCP, is developing HIV counseling and testing modules. It's quite a process, but Dr. Bellimac hopes that this would address the concern regarding virtual training needs, especially during this pandemic. In the meantime, as showed in the slide earlier, please do refer to the DOH Admin Order 2017-0019, which provides detailed steps and guidance on the conduct of HIV testing counseling, including PICT. And this can serve as reference material to all our healthcare providers if you wish to offer the HIV test to your patients. So while the DOH understands the complexity of this issue, we believe that health organizations and institutions are doing its best to equip the healthcare staff to be able to comply with the provisions of RA 11166. Yon.
Yay! Yon, thank you very much, Doc Kate. So again, kahit anong mangyari, pwede kayong you can be an HIV counselor if you want to help, if you want to volunteer. There are so many initiatives happening, especially right now, because it's World AIDS Day. So maraming salamat, Doc Kate, for
Thank you, Doc Kate.
that. Yes. And ayun na nga. So those are the 11 burning questions.
Burning.
Yes, burning questions. Maraming salamat pong muli sa ating mga doctors sa pagsagot ng ating mga katanungan at nakita naman natin kung gaano ka-active hanggang ngayon ang ating mga healthcare workers online and on social media sa pagtulong ngayong quarantine.
Oo, lalo na dahil may mga health services na nagsara or nabawasan dahil kailangan malipat ang mga COVID facilities. Sa COVID facilities, ang manpower or para maiwasan ang exposure dito, nagkaroon tayo ng ibang medium of healthcare. Paano naman naepektuhan ng COVID ang mga nakasanayan na nating HIV services, di ba? Gaya ng testing, check-up sa clinic, at pamimigay ng libreng ARV sa mga pasyente. I'm sure isa to sa mga burning questions natin, right? Nag-adjust kasi tayo sa bagong normal.
Yes, sobra.
Yes,
Ayan
so
na.
we have been forced to adapt to our response of HIV and AIDS in communities to ensure the community of our ongoing services.
Yes, as we know, COVID-19 has revealed not only the critical issues related to health, but it also put a spotlight on communities that found ways to bounce back by grounding their responses to life-saving health care. Ayan.
Yes.
So, yes, nakita naman natin. Ako, ang dami ko nakita online na parang merong partnership with Angkas para it's so easy for our brothers and sisters living with HIV to have their medications delivered sa kanilang mga bahay. So that is sobrang ang saya-saya at sobrang convenient for all of us, especially hindi tayo lahat makalabas.
Absolutely. And again, one of the upsides of, again, having to shift kasi virtual is that it's so accessible to everybody and we just really see, I guess we get more courageous and more emboldened lang tayo because we realize, my God, the scope, diba, of this help and the scope of this community that, you just don't feel like you're alone. So again, just another positive thing to come out of this whole thing, diba? Na-strengthen lang yung community. And while this year magnified the challenges faced with people living with HIV, it's also been a wake-up call. Like I said earlier, it's an opportunity to work better together. I think that's what's most important, right? Together. We don't feel alone. We have seen how community solidarity has given so much more than just access to continuity of treatment, care, and support. It even showed us strength and gave us hope. This would not be possible without the support, guidance, and mentorship of our doctors.
Yes, and since today is all about the world uniting, show support for people living with and affected by HIV and AIDS, and to remember those who lost their lives, it is also the time to come together and express our sincerest gratitude to healthcare professionals who have shown us unshakable strength. I'm very sure marami sa mga nanonood sa atin ngayon ay mga healthcare providers, mga nangangalaga, silang mga nandyan. As in, ilang beses natin sinasabi yung frontliners. Pero hindi natin alam the magnitude of their sacrifice. So
24/7 yan.
24/7. Nakita natin kanina yung isang doktor natin ay sumasagot ng mga tanong ngayon while on shift. So, alam mo yon, ganon. that's how they are dedicated with this. And yun nga, yung mga sila mismo ang mga nangangalaga sa ating mga kapatid na living with HIV. And
Yes, as they
maaring
say,
hindi,
diba? Real heroes don't wear capes. I just wanna reiterate that.
yes, that's very totoo. And I'm very sure na maring hindi masabi sa inyo ng mga pasyente ninyo yung kanilang pasasalamat, pagmamahal. Kaya you're in for a treat. Meron kaming sorpresa para sa inyo. So let's watch this video.
The Asian COVID-19 survey was launched in October 21 in 10 countries in Asia. It was a 10-minute quantitative online survey intended for PLHIV, key affected populations at risk for HIV, and prescribers. The survey was sponsored by Gilead and analyzed by the Kantar Group in Singapore. The purpose of having the survey was to assess the status of HIV service delivery during COVID and to identify the gaps thereafter in the hopes of encouraging discussion among stakeholders to address these barriers and limitations. The survey was created with the objectives of identifying how COVID impacted PLHIV and key affected population with regards to access to medicine, healthcare, sexual behavior, stigma and discrimination, and to identify how it affected clinic time with patients, access to preventive care, access to HIV testing, and the use of telehealth. As of November 20, these were the respondents from the different member countries. There were 5 main messages resulting from the survey. Under access to HIV care, prescribers experienced disruption. About 50% experienced disruption of HIV care in terms of frequency of visit and patient load. Personal visits at the clinic were less frequent. There was a 38% decrease in key affected population and a 31% decrease in PLHIV seen at clinic. Significant in the Philippines was a 74% decrease in PLHIVs seen at the clinic, which was echoed by the PLHIV respondents as well. The second message conveyed by the survey regarding access to ART was that during COVID, prescribers reported more interruption compared to PLHIV respondents, and that both PLHIV and affected population have concerns about long-term access to medications. The major reason stated for interruption in ART access is travel constraint. More than half of the respondents who reported interruption in medication either decreased the amount of intake or totally stopped taking their ART. Fortunately, among Filipino PLHIV responders, only 9% reported treatment interruption, which was lower than most countries. Having experienced ART shortages and stockouts before, it isn't surprising to see that Philippine responders, a whopping 83%, were concerned about long-term ability to access ART. And among HIV-negative respondents, 63% were concerned about their ability to access PrEP. The third message was related to access to HIV-related testing. Both PLHIV and key affected population reported decreased access. 1 out of 5 PLHIV reported decreased viral load testing frequency, while almost half of key affected population reported decreased HIV testing due to less frequent engagement in risky activities and concerned about catching COVID when they go to testing centers. Compared to other countries, the Philippines recorded a significant decrease in viral load testing during COVID, about 74%. Main reasons stated were travel constraints and concerns about getting COVID from hospitals and clinics. HIV testing among respondents in the Philippines was significantly impacted compared to our Asian neighbors. Reasons for the decreased frequency of testing were decreased engagement in risky behavior, travel constraints, and risk for COVID. The fourth message from the survey was about HIV prevention services. These were heavily impacted by the COVID pandemic. 61% of prescribers in Asia report that they have decreased or stopped prescribing PrEP. This seemed to echo the key affected population respondents about their disruption in taking PrEP. Many respondent countries' prescribers said that COVID limited access to HIV preventive medications, and many key affected population on PrEP report decreased taking of their meds. The final message of the survey was about the adoption of telehealth as a new mode of communicating with patients. Telehealth was preferred due to convenience, time efficiency, improved workflow, and a wider coverage of patients. However, patients do report that not all doctors provide this service. Higher adoption of telehealth and remote refill of ART was seen in the Philippines compared to other country respondents. Remote refilling was preferred by most patients, and video consultation was preferred over a phone call. Despite our slow internet speeds, the Philippines has the potential to be early adopters of e-health. 82% of prescribers in the Philippines expect an increase in adoption of telehealth services in the future. With the following reasons stated as advantages, this may be helpful for us to learn from and prepare for in the coming months as we adjust to our new way of life. In summary, this survey reveals that the Philippines' access to HIV care was among the most disrupted in the Asia-Pacific region due to travel constraints during COVID. Filipino respondents are most concerned about their long-term ability to access ART, which is the highest reflected in the region. The survey also provides insights on the adoption of telemedicine as a future of HIV care. Early during the pandemic, UNAIDS and UNDP conducted a survey among 241 PLHIV in a rapid assessment of the impact of COVID on the national HIV response. In the survey, PLHIV respondents reported that transportation or delivery issues, including checkpoints and distance of treatment hubs, were the biggest concerns, all of which relate to access to ART. Compared to their male counterparts, women living with HIV were found to be more concerned with the need for relief that is responsive to their needs, such as milk and vitamins and provision for antenatal care and reproductive health services among pregnant women. A thematic analysis of inquiries received by the Philippine HIV Response Center, or PRC, showed that these were the main categories of most commonly asked questions. Questions received by the PRC on ART refilling pertain to access points and contact details and requirements for refilling among transient clients. The platform also answered queries on the vulnerabilities and risks of PLHIV to COVID and whether ARV regimens are to be used in the management of COVID cases. The latter suggests concerns with regards to the implications of this to the ART supply of the PLHIV community. The PRC also received requests for financial assistance to cover courier services and to deliver ART and other services such as food. With the country on strict lockdown in the earlier months of the year, it isn't surprising to see that lack of mobility is the number one problem. Courier services were not fully operational, and if they were, clients did not have the resources. It was estimated that it would take isolated PLHIVs 21.2 hours on foot at most to reach the nearest treatment facility. This problem was much more acute for clients residing in Cagayan Valley, Central Luzon, Calabarzon, Central Visayas, and Mindanao. The FPCP, which heads the local AIDS program, had anticipated this potential problem and used this as the basis for allowing clients to refill at any treatment facility close to them. We have more than 150 clinics and hospitals. However, not all have complete ART supply. This problem was further complicated by concerns of stigma and discrimination when crossing checkpoints at borders resulted in unnecessary disclosure of HIV status. Even the delivery of ARV supply directly to their homes caused much anxiety to PLHIV. Other issues PLHIVs were concerned with were about financial security, employment, and mental health. Because of no work, no pay arrangements, PLHIV are uncertain as to where they will obtain resources for their daily needs. Beyond this, there were questions around the status of their PhilHealth contributions and what the impact of this is on their eligibility for GOHAT services. In response to these barriers, the Department of Health emphasized the policies and guidelines that could be used related to COVID-19 response and HIV at the national, regional, and local levels. HIV services were made available as they are under essential health services, and access to ARVs were to be ensured for any PLHIV, whether foreign or local, who needed them. PhilHealth also allowed for refunds of courier services from the outpatient HIV and AIDS treatment package. In summary, these are the HIV services that were greatly impacted by the COVID pandemic: HIV testing outside testing facilities, financial assistance, and viral load testing. The impact of COVID on HIV services was immense, but the need to continue providing care to the patients in need was of greater significance. Lest we forget, we have the fastest rising rate of new infections in the world, and we have yet to catch up to the challenge presented by the global HIV community to end AIDS by 2030. But we have our community, and our patients are part of that community. Patients become partners, and partners become leaders. Meaningful engagement. We are honored and privileged to share with you just some of the best practices in HIV service delivery in the time of COVID.
Hello everyone, I'm Stephen, but in the community they call me Gray. And yung treatment hub ko is in NMMC. It's in Cagayan de Oro. So I've been, I was diagnosed for about 8 years na. So far okay naman. Parang kung babalikan ko yung 8 years ago, nagsimula, it's really hard kasi you don't know what will happen, parang ganito. But when you get hang of it, okay na din siya. Parang ano na, normal na siya. Hindi na siya tulad na you get this anxiety or you have that series of depression or something. Pero right now, hindi mo na siya namamalayan. You're just taking the pill and then that's it. So far, it's all really good even though it's pandemic, but so far, sobrang okay. Definitely yes. Kasi when the treatment have started, the doctors are very okay eh. Like yung, alam mo yung compassionate talaga with what they do, and then of course the nurses are super accommodating, and lalo na pag may mga emergencies, tapos pag urgent talaga, when those urgent, may mga issues na ganun, mabilis silang mag-respond. So, super nakatulong yung gano'n na factor. Yung talagang nag-handle for the hack itself is silang dalawa. So, it's Dr. Frias and then Dr. Salon. So, kung ikaw bago ka and then nakikita mo yun na ganun ka, ganun yung process, so definitely, you'll be really fine. With Dr. Salon, I think it's her interpersonal skills. Yun yung isa dun na parang the way she treated the patients, parang kwento-kwentuhan lang ganun. And then she really explained it thoroughly. So hindi niya minamadali. With the discussion, and then if you have other questions, tatanong pa yan parang at the end of the session or yung consultation, meron ka pa bang other concerns? So very specific siya for that. Yes. Kasi pag andun ka na sa situation na yun, kailangan mo ng someone that who can listen. Like not just listening, but deep listening and understanding what are you going through. Then explaining it to you. Mapa-medical man siya or mapa-layman's term, but ini-explain siya kung paano at ano yung steps na pwede mong gawin. To Dr. Salon, could just continue. Kung sa term pa namin sa Bisaya, padayon in what you do. And if there are times na medyo nakakapagod, tuloy lang talaga because that's really a noble work that you're doing. Your attitude towards the people living with HIV is really incomparable. So, padayon lang to what you do, and definitely kami as advocates will be here to really assist you with that, and also to encourage other POS na you have a better life ahead of you.
Ako po si Gerald, 20 years old, sa Lazaro Hospital po. 12 years po. ...2008 po. Si nanay lang po nagsabi po sa amin yun eh. Pero lagi na po kami nagkakasakit na nagkakalagnat. Pabalik-balik po kami sa hospital, ganun po. Tapos yung pumunta po kami sa San Lazaro, nalaman po na meron nga po akong ganun po. Si Dr. Miranda po at si Dr. Olive po. Si Dr. po Miranda, mabait po siya. Si Dr. Olive naman po, para po kami tinuring na anak po ganun po. Minsan po, pag wala po kami pera, pinapasobrahan po yung gamot para po matagal po kami makabalik doon. Ituring din po nilang parang pangalawa po nilang anak po ganun po. Mas lagi po silang mabait. magpapasalamat po ako sa kanya. Dahil po sa kanya, sa paglilingkod niya po sa amin. Parang mahaba pa po yung buhay namin.
Na-diagnose ako nung 2013, May 23 sa RITM sa Alabang. But currently, I'm being taken care of by the FPOP Iloilo na primary care clinic. Dito rin po sa Iloilo City. Magsi 7 years or mag-8 years na rin ako itong coming May 2021. Sobrang baba kasi ng CD4 ko noon, mga 5 na lang. Iyon, nagkakasakit-sakit pa hanggang sa na-confine pa ako dito sa Iloilo. Nung umuwi kasi ako nung June, the following month, July, na-confine ulit ako sa the Western Visayas Medical Center. Tapos pabalik-balik yung pneumonia. Siguro yung pneumonia, even prior to my diagnosis, parang nandun. So, at yung ang pangit lang noon dahil nagsisimula pa lang ako noon, parang grabe yung anxiety and well, yung mga bouts of depression din. So hindi talaga maganda yung situation. Siguro sa buwan na yun, sa taon na yun, parang pang 3 or pang 4 ko na pneumonia. So yun, I was being taken care of one of our consultants at the VVMC, si Dr. Feliz Molina. Kasi nga parang ang daming nangyayari sa akin na parang kailangan talagang ma-manage ng maayos. So I was glad that I was under the care of Doc Feliz. Siyempre, deep inside, napapaisip talaga ako na will I be able to survive this? Imagine mo from 65 kilos down to 40 kilos in less than 2 months. Parang naghihintay na lang talaga ako na baka anytime mawawala na talaga ako. Papaniwala niya sa akin that the ARV treatment will really work. Although at that moment, kailangan niya lang i-manage yung mga sakit ko, yung mga opportunistic infection. Sabi niya, gawin mo lang lahat ng makakaya mo na ma-survive mo yung mga complications kasi yung gamot, eventually, yung ARV, tutulong talaga yun na magpa-increase ng CD4. And yun nga, siguro mga after 6 months, tumaas din siya. Although, gradual yung pagtaas niya, pero nakikita ko talaga na may improvement sa akin. So, it actually helped me to cope up. And even yung mga bouts of depression and anxiety, natulungan talaga because of yung faith dun sa medical science na things work pala and then may mga solusyon pala sa mga problema or mga complications. Iba yung dating ng isang specialista na magbibigay sa iyo ng peace of mind pag sila yung nagsasabi talaga. Kasi although they're talking about very clinical things, ang effect niya sa akin as a patient is buhay ko kasi yun talking about am I going to live or am I going to die? And at that point, talaga yun. Parang yun talaga yung nag-inspire sa akin na kung magsusurvive ako, I want to do something, I want to pay forward because of people like Doc Feliz na was able to help me go through those difficult times. Iba yung impact talaga ng mga service providers na makapagbigay sa atin ng peace of mind, that the right information delivered in a very compassionate way at very hopeful. No? It helped me, like parang 50% nanggaling kay Doc, tapos 50% na inspire ako to fight and to move on, para lumaban at mapagaling din yung sarili ko. So iba talaga pag yung na-inspire ka ng isang tao na mabuhay, then yung tendency is you want to help also para in the future may matulungan ka rin na ibang tao and pay it forward. So thank you very much, Doc Feliz. Kung hindi dahil well, kung hindi siguro dahil sa'yo, I will not be able to do the things that I'm doing right now. So iba talaga yung ginagawa nyo, and we appreciate all of you for what you're doing for us, especially right now. Ang sinasabi nga, shared responsibility. Kung may responsibility ang mga service providers or mga doctors natin, kasama ninyo kami sa responsibility na yun, and we'll try our very best to actually hindi masayang ang lahat ng mga pinaghirapan nyo sa amin. Thank you very much, Doc.
Wow. Okay. Well, we've been saying this many times over, but our healthcare workers in the front lines do the tireless, sometimes thankless job providing health, care, and support far beyond what's expected of them. And the COVID pandemic has magnified how important they are in more ways imaginable. Hindi man po namin masabi parati ang aming pasasalamat at ang aming pagmamahal, but we're doing it now. Maraming salamat sa lahat. So let's continue the fight against HIV and AIDS. Kagaya nga ng sinabi ni Robert kanina, tuloy ang laban upang hindi masayang ang mga pinaghirapan ninyo at patuloy na pinaghirapan ninyo. Thank you very much to our healthcare workers, healthcare providers.
Yes, may this also inspire you guys to just send them thanks, however little that may be, kahit text message, kahit ayuda. I'm sure that they will gladly accept your thanks.
Oo, yes. Ask niyo yung mga Gcash nila.
All right, so moving on to our next segment for today. One of the things that, again, we want to work more on is reducing the stigma and discrimination in our healthcare settings. The hospital, the clinic, the community health center need to be safe spaces where zero stigma and zero discrimination occurs. We take this opportunity today to commit to this.
Yes, we all know how essential it is to feel safe, to be respected, and to receive compassion from others. Just like healthcare workers who have experienced discrimination in a year dominated by coronavirus, Ate, we know that you can empathize because PLHIV also deserves kindness and empathy. We are happy to know that hospitals and healthcare workers are stepping up with the launch of a new national initiative. So please, everyone, let's watch this video.
Good afternoon. I am Dr. Angelo Juan Ramos, Executive Director of SHIP. Welcome to the launch of the Philippine Stigma and Discrimination Reduction Quality Improvement Learning Network. We are proud to be partners of PSMID, UNAIDS Philippines, and UCSF HealthQual. We know that we need to address HIV-related stigma and discrimination in hospitals and other healthcare settings. So, our overall aim is to reduce stigma and discrimination in Philippine healthcare facilities. In the coming months, we will work closely with HIV and AIDS teams from 13 hospitals to determine baseline levels of SND among healthcare workers develop interventions to reduce and eliminate them, and to find ways to scale up and mainstream initiatives to improve quality of care for people living with HIV and at-risk groups. In a previous workshop, we identified the drivers of stigma and discrimination in hospitals, and these are areas that we need to act on, namely education and awareness, hospital policies, peer involvement, clinic systems, and the routine measurement of stigma and discrimination. We welcome our partner hospitals. For Luzon, we have the Bataan General Hospital, Jose Bilingad Memorial Regional Hospital in Pampanga, and the Bicol Regional Training and Teaching Hospital in Legazpi. For the Visayas, we have Corazon Locsin Montelibano Memorial Regional Hospital in Bacolod, Cebu Provincial Hospital in Balamban, and Vicente Soto Senior Medical Center in Cebu City. And for Mindanao, we have the Southern Philippines Medical Center in Davao. I now ask you to hear the voices of those who have experienced stigma and discrimination and our partner organizations who are committed towards their elimination. Welcome to the network.
Hello, I'm Dr. Bruce Agans from the University of California, San Francisco Health Qual program. And I'm grateful and honored to be joining you at this all virtual 42nd annual convention sponsored by PSMID. I also congratulate PSMID on the celebration of their 50th anniversary. That's a wonderful milestone. And as an infectious disease clinician, it gives me great pleasure to be able to celebrate that milestone with my colleagues in the Philippines. I'm particularly pleased to join SHIP's session on Better Together, focusing on the meaningful involvement of people with HIV in healthcare. SHIP and PSMID have joined together with other donors to support the launch of a very important activity in the Philippines, a quality improvement learning network that is going to focus on reducing stigma in healthcare facilities. They're joining our multi-country network in Southeast Asia that is devoted to this activity. This network is devoted to combating stigma. We know that stigma is a main driver of preventing us from reaching our targets to end the AIDS epidemic. We know that stigma can be harmful and damaging to people. It prevents them from coming into a care setting. Once they're in it, it may prevent them from staying connected to care, and it may trigger major mental health issues as well. Sometimes we forget that our actions can be triggers for stigma, and that we can do something about that. And indeed, stigma is actionable in healthcare settings. We can change the way that we behave, we can change the way our systems are set up, and make them more welcoming and friendlier to people. SHIP has done a wonderful job in organizing the network, in partnering with PSMID, which has led the meetings and come together as a group to recruit a number of hospitals, 13 in fact, all of whom I would like to congratulate on stepping up to join this important initiative. It's a great privilege for me to be able to join you virtually in network meetings. I hope that I'll be able to come in person as well at some point. But I've been so impressed thus far, following on the design meeting for this initiative, with the enthusiasm, with the energy and the commitment that I've seen among providers and people from the community to undertake this important initiative. And it is my hope that once its success is demonstrated, that it will be scalable, that it will be something that can be implemented routinely across the health system so that we can make care better for people with HIV, and especially for key populations who comprise the HIV and at-risk population, so that we can provide the best possible care to them so they can have their outcomes achieved with better health-related quality of life, and also achieve our epidemic and population health goals of ending the HIV epidemic. I come back to health-related quality of life and remind us that that's the fourth 90, that not only are we trying to make sure that everybody is suppressed, but we want them to live productive, meaningful, and positive lives. And in doing so, to help make that happen, we want to focus on patient experience and making the healthcare system stigma-free. I hope you have a great workshop. I hope it's been a great conference and continues to be. And again, I look forward to meeting you all in person and congratulate you on the success that you have achieved and will continue to achieve as you move forward with this initiative. Take care.
This journey of my life and breaking stigma around HIV is something that will have legacy everlasting. Isang mapagpalang araw sa ating lahat. Ako nga po pala si 2019 January 17, isang taong nabubuhay na may HIV mula sa San Marcelino District Hospital under of Shelter of Hope and Ocean of Hope Support Group. Ako'y 5 years nang PLHIV or person living with HIV. But I started my ARV since 2018. Pero nalaman ko ang aking status past 2015. Because of stigma and discrimination na aking naranasan, hindi sa mga taong nakapaligid sa akin, kundi sa mga taong akala ko tutulong sa akin about my status. Silang healthcare workers na unang nakaalam ng aking status. Way back 2015, na mapaplanuhan kong mag-apply to abroad para ay sa kagustuhan kong umahon ang aming pamilya. Then I passed the all examination, interview, August 11, 2015. Ito yung date na hindi ko makakalimutan. Kasi ito yung date na I'm ready for medical. Then August 18, pinabalik ako for my result of my examination, medical examination. Pagpasok ko, tanong kagad ng pangalan ko. Doon nagsimula ang malabangungot kong pakiramdam. May mga matatalim na matang nakatingin sa akin. Pinag-uusapang keso kadiri, kawawa, at kung ano-ano pang di katanggap-tanggap. Pinaupo ko sa isang sulok na nag-iisang silya na nasa sulok. Naghihintay ng ilang oras sabay duro sa akin ng isang babae. Ay yung nakapolo, yung maitim. Kitang-kitang lisik ng mga matang pandidirik na halong may pagtawa. Gulong-gulo ako, ano ba nangyayari, anong meron sa akin. Kung bakit ganito ang pinapakita at pinaparamdam sa akin. Na para bang nakagawa ko ng kasalanan na hindi ko kayang pagbayadan. At pinasok ako sa isang room kung saan dumaan kami sa laboratory. Matalim na mata, lahat sila'y nakatingin at nagbubulungan. At doon nga sinabi sa akin ang status ko about HIV. Ay may HIV positive. Walang emosyon akong naramdaman nang malaman ko ang bagay na iyon. Mas pansin ko ang diskriminasyon at sakit na nakita ko na pinaramdam nila sa akin na para akong isang kandilang natutunaw na walang kalaban-laban. Mas gusto ko pang hindi lumabas sa kwarto na iyon dahil masyadong masakit ang kanilang mga sinasabi at nakikita ko sa kanilang pagdidiri. Pinag-uusapan at sabihin na kung ano-ano. Doon ko nga nasabi, sa mata pa lang pinapatay na nila ako. Paano ako magsisimula? Saan ako tatakbo? Saan ako magsusumbong? Anong idea saan ako lalapit para sa aking nararamdaman at para sa aking kagalingan? Doon, nabuo na rin sa aking isipan mamatay kung mamatay. Dahil kung ang mga healthcare workers na ginaganito ako, paano pa kaya yung pamilya ko? Paano pa kaya ang kaibigan ko? Para akong sikat na artistang pinagtitinginan mula ulo hanggang paa. Ayun, hindi nga ako nagkamali pagkalabas ko ng silid na iyon. Ganun nga ang nangyari. Kaya siguro, at sigurado ako na itinanggo ko ang aking status sa loob ng 3 taon. Dahil sa aking diskriminasyon na karanasan. Ayaw ko nang balikan ang ganung pakiramdam. Pero ito ako ngayon, lumalaban at hanggang maging inspirasyon sa mga katulad kong person living with HIV. Tandaan lang natin na mayroon nag-iintay pa sa atin na bagong araw, buwan at bagong taon. Hindi kawalan ng sakit na HIV, kawalan ang hindi ka lumaban. At ngayon, nasa maayos akong kalagayan. TV4 1028 and my viral load is undetectable. Then nagpapasalamat ako sa ko, Shelter of Hope and Ocean of Hope na nagbukas sa akin ng positibong pananaw at mainit na pagtanggap bilang person living with HIV. Ang nais lang po namin ay serbisyong may puso ng healthcare workers. Maraming salamat.
To join us this afternoon, I'd like to call back the main man tonight, the Executive Director of SHIP, Dr. Jello Ramos. Hi, Doc Jello.
Hi, Topper.
Hello. Thanks for joining us this afternoon.
Thank you. I'm glad to be here. So, yes, Jeff, no, we really hear you. And actually, with this initiative, we will really address the issues, no, of HIV, stigma, and discrimination in health facilities and with health workers, no. So, SHIP, PSMID, UCSF, and our partners, we will be doing this in the next couple of months, no. So in the next video, we actually have some messages and calls to action from our other partners, the Department of Health and UNAIDS Philippines. So over to you, Topper.
All right, so like Doc Jello said, no, let's just watch this next video just to see just some more messages from the people in the front lines.
More than 3 decades since the first reported case of HIV in 1984, the Philippines has come a long way in understanding and addressing HIV. Despite this, discrimination against people living with HIV and even the key populations in general, whether done on purpose or inadvertently, still persist in the family, in the community, in the workplace, and most importantly, in the healthcare settings. Such reality continues to haunt the PLHIV in their lifetime. Discrimination in the context of HIV refers to the unfair and unjust treatment of someone based on their real or perceived status. In my years of HIV work in the department, I have learned that discrimination could start from mundane things that we do as healthcare workers. From the non-verbal cues we show our patients, the mere raising of the eyebrows, not looking straight into the eye of our patients, the inappropriate use of hand gestures, to providing unsolicited advices to the patients. These are few examples that could ripple into a full-blown stigma and discrimination. Discrimination is often fueled by myths or ignorance of HIV transmission and pre-existing biases against certain groups, sexual behaviors, drug use, and fear of illness and death. Stigma attached to HIV resolves to discrimination. That HIV is a life-threatening infection, people react to it in strong ways. HIV-related discrimination translates to loss of livelihood or income, rejection by the family, or ostracism by the community, withdrawal of caregiving in the home, denial of schooling, marriage, and childbearing options, poor care within the health sector, loss of hope, dignity, self-esteem, confidence, or a sense of worthlessness, loss of reputation, among others. In the 2019 Joint Program Review of the Department of Health HIV Program, stigma and discrimination were identified as psychological and social barriers in the access to HIV services. Further, at the height of the enhanced quarantine, access to ARV based on proximity of treatment facility is complicated by the fear of the PLHIV on stigma and discrimination, that they will be stigmatized and discriminated on their way to the treatment facility. Discriminatory acts and practices in the workplace, learning institution, restrictions on travel and habitation, exclusion from credit and insurance services, discrimination in hospital and health institutions, denial of burial services, prohibition from seeking or holding public office, and other similar or analogous discriminatory acts are prohibited under the Republic Act 11166 or the HIV and AIDS Policy Act of 2018. Moreover, there is the most recent move of the Philippine Congress to pass a legislation on anti-discrimination, which includes the issues of PLHIV. This bill hopes to cement the provisions of the anti-discrimination in the RA 11166. In furthering the universal health care, we urge everyone to be truly inclusive in all our undertakings. We need to engage the most important partners in our program development, implementation, and evaluation. And these are the communities of people living with HIV. With the diverse partners we have in this forum, I am truly optimistic that we can cure together the disease that we ourselves created, that is stigma and discrimination. Magandang umaga po sa inyong lahat at mabuhay tayong lahat.
Amidst the COVID-19 pandemic, the country has another epidemic. HIV infection continues to rise like a thief creeping into the night while we are all preoccupied with COVID-19. Based on the 2020 Global AIDS Report, the country marked a 207% increase in new HIV infections and 303% increase in AIDS-related deaths in the period of 2010 to 2019. And that puts us in the spotlight by having the fastest growing HIV epidemic in the world. The Joint United Nations Program on HIV and AIDS, or UNAIDS, is the main UN body that advocates for an accelerated, comprehensive, and coordinated global action on HIV and AIDS epidemic. In order to bring the country's HIV response to the new age, the government enacted the new AIDS law, or Republic Act 11166 in 2018, which demonstrates the strong commitment of the country to end HIV epidemic. This new law not only intends to provide quality services, but also aims to protect and uphold human rights of key populations and to eliminate stigma and discrimination. Today, as we commemorate World AIDS Day, people around the world unite to show support for people living with and affected by HIV, and to remember those who lost their lives to AIDS. The world's attention has been focused on the COVID-19 pandemic and how pandemics affect livelihoods and lives. COVID-19 is showing us once again how health is interlinked with other critical issues such as reducing inequality, human rights, gender equality, social protection, and economic growth. With this in mind, this year, the theme of World AIDS Day is Global Solidarity, Shared Responsibility. COVID-19 has demonstrated that during a pandemic, no one is safe until everyone is safe. Leaving people behind is not an option if we are to succeed. Eliminating stigma and discrimination, putting people at the center, and grounding our responses in human rights and gender-responsive approaches are key to ending the colliding pandemics of HIV and COVID-19. We have seen how the COVID-19 crisis has exacerbated the challenges faced by people living with HIV and key populations, including in accessing life-saving healthcare, and how the crisis has widened the social and economic inequalities that increase the vulnerability of marginalized groups to HIV. However, this crisis has also been a wake-up call, an opportunity to do things differently, better, and together. Despite decades of scientific advances in prevention and treatment, as well as widespread awareness-raising efforts, irrational fears of HIV infection, and negative attitudes towards key populations are a persistent barrier to addressing the HIV epidemic. For this reason, the Sustained Health Initiative of the Philippines, or SHIP, launches its newest program, the Philippine HIV Stigma and Discrimination Reduction Quality Improvement Learning Network, to address the pervasive stigma and discrimination in the country. And UNAIDS Philippines fully supports this program, which aims to reduce, if not totally eliminate, HIV-related stigma and discrimination in healthcare setting. We believe that the overarching effects of stigma and discrimination can make or break the gains we have in curbing this epidemic. I would like to commend PSMID and recognize your support and invaluable contribution to the HIV program. And I hope that you will continue to support the Philippines' HIV response collectively as an organization and even as an individual practitioner back in your respective clinics. The World AIDS Day calls on all sectors of the community to step up their efforts to achieve healthier societies. This World AIDS Day, let us demand for global solidarity and shared responsibility. Thank you and congratulations to PSMID on your 42nd Annual Convention and 58th Anniversary. Mabuhay po kayong lahat.
We'd like to call back Doc Jello. Thank you so much, everybody.
Thank you. So as we celebrate World AIDS Day, I invite all PSMID participants, healthcare workers, and supporters of the HIV community to join us now as we affirm our commitment towards eliminating HIV stigma and discrimination for good.
In line with a shared vision of zero new HIV infections, zero discrimination, and zero AIDS-related deaths, and as a steward of health in the hospital and in my community, I pledge to work harder and do more to eliminate all forms of HIV-related stigma and discrimination, and to improve the quality of care of people living with HIV and AIDS.
So thank you very much, everyone, for your commitment. So to close this session, I would like to call on the President of PSMID, Dr. Marisa Alejandria.
Thank you, Jello. And thank you to SHIP and to the HIV community for enriching and making our 50th anniversary a memorable one with your participation as we celebrate World AIDS Day. So thank you to SHIP, UCSF, Institute for Global Health Sciences for this opportunity to partner with you in the fight against stigma and discrimination. Thank you, Kate and Janice, for leading this initiative in our country. And to the first 13 partner hospitals participating in the Philippines Stigma and Discrimination Quality Improvement Network, thank you for your commitment, and I wish you a productive engagement in this timely initiative. We look forward to the upcoming activities of the network, starting off with the baseline surveys of health workers and patients, the upcoming workshops, mentoring and sharing sessions, as we craft strategies to fight stigma and discrimination. We also look forward to more treatment hubs participating in the SNDQI network in the coming years as we move towards the overall goal of improving patient experience and achieving the fourth 90 of improving the quality of life of our patients with HIV. I now rally and call to action all PSMID members, all healthcare workers, to eliminate stigma and discrimination in healthcare facilities, the missing link in our mission to control and eliminate HIV. Congratulations and Godspeed. keep safe, everyone. Thank you.
Yes, thank you very much for that message, Dr. Marisa Alejandria. Yan, maraming salamat.
Yes, we also want to thank, of course, the main man, the Executive Director of SHIP, Dr. Angelo Ramos, or Doc Jello, as he'd like to be called.
Yes. And so, grabe, maraming salamat po sa inyong pagsama sa amin ngayon. Thank you very much. Topper, if there's anything that you'd like to say before we close the session.
Absolutely. I mean, I just want to really just give thanks to, of course, everyone today, to all our doctors, to all the people in the front lines. I know you guys have been thanking us for hosting this show, but sa totoo lang, this is a pleasure for both me and Fee. I know I speak also on behalf of Fee, just so that you know that this is so rejuvenating, it's so inspiring, and may this also be a call to action to always just try to go for more education, right? And to just really try to erase stigma and discrimination as much as we can. Every little step helps, di ba, Fee?
Yes, that's right. I'd also like to thank SHIP for this program. Totoo. It's really better for all of us to be better together. Better together, meaningful engagement of people living with HIV and healthcare. I'd also like to say congratulations on the 50th anniversary of PSMID.
Yes,
Again,
PSMID.
yes. Expanding horizons for gold. PSMID in the forefront against COVID-19. Thank you very much for having us. And 3 decades, we have come a long way, but we don't rest on our laurels. No pandemic can halt how we can further improve our services and make us lose our humanity. Indeed, mabuhay po kayong lahat. And as we celebrate World AIDS Day today with the theme Global Solidarity, Shared Responsibility, let us remember that no one is safe unless everyone is safe. Again, this is P. Palmos. Maraming salamat po sa inyong lahat. And again, I'm so happy to be doing this with you, Topper.
Yes, oh my God, the pleasure is all mine. And alam mo naman na today is World AIDS Day, and it's a time that we always remember those we've lost to AIDS, but at the same time, it is also a great day to also remember all the advancement and all the steps that have happened during the past few years, where we're at now, and again, a call to action to just keep improving so that, again, we can capital LIVING, right? Living with HIV tayo.
Yes, we remember those we've lost to the battle, but marami pa pong lumalaban at patuloy na lumalaban. So let us also celebrate them. Those who are living, those who survive, those who can still tell their stories.
Absolutely.
So maraming salamat.
And maybe also celebrate them all year round, not just December 1.
Yes, all year round. Hindi natatapos sa December 1 lang. Dapat lagi-lagi natin itong pinag-uusapan para hindi sila makalimutan.
I also hope that this inspires not just people living with HIV, but just people in general to just give their thanks to the people who are working tirelessly every day, 24/7, almost selflessly, as di ba we were reiterating kanina. Ayun, send them your thanks, send them your love, post about it on Facebook, just send your gratitude, send them ayuda, yung Gcash, according to Fee. But also, I think just being very public about your thanks is, again, just another help and another step towards just erasing, again, the stigma and discrimination against people living with HIV.
Yes, thank you very much. Again,
thank you so much.
Thank you very much to everybody. Grabe, thank you so much.
Thank you. This is Topper Fabregas.
This is P. Palmos. Bye, guys. Have a great day.